Good evening, all of you. Today, I just wanted to speak a few words about OMICRON and the face masks mandatory. So, now the current new year, there is a new third wave variant which is upcoming. So, I just wanted to speak some few words about this current COVID 19 variant, effectiveness of different types of facial masks in this rapid spread of new variant called Omicron in this new year. Need first shield of the defense is face mask. So the data shows for this current Omicron variant, if two persons, for example, is used to talk without masks, one of them already get infected and other persons within 15 minutes with the cloth masks can be infected. And the two persons used to speak, if one person is using a cloth mask, another is not using, 20 minutes it will take to get infected. There is an infographic picture also I have been attached. How this a person is getting infected, an infected person with a healthy person. And cloth mask does not provide protection against virus, whereas N95 masks are the best offer maximum protections. It will take 2.5 hours between the two persons to get infected. If one wears a mask, another does not. If both wears a mask, it will take 25 hours to transmit. So we are having a chance to escape if we wear a mask, particularly N95. And even in surgical triple layer masks, 30 minutes to get infected if one person is putting a mask and another person is not using a mask. Otherwise, if we both persons, infected person as well as the healthy individual, use masks, it will take 15 hours to get infected. So these are all the possibilities of getting infection in indoor rooms, for example in home, as well as in the lift, or as well as in the operation theaters, or in hospitals, or in small closed ventilated shops. These are all the possibilities of getting infections. One is using a mask and another is not using a mask. So among them we can see that N95 masks which having a high protection and a high defense mechanism. And Omicron is the most fast spreading variant of SARS-CoV-2. Even 2 or 3 doses of vaccination, we get Omicron. If we does not wear a mask or wear cloth masks, you might get infected even if you are vaccinated. But the infection and the problem which is very less when compared to unvaccinated populations. Even we are getting vaccinated, we don't think that we are vaccinated and we doesn't want to wear a mask. We supposed to wear a mask. That is very important. And wearing a cloth mask, you may get infected by speaking, coughing, sneezing within 27 minutes. So surgical and N95 masks are highly protective. Then there are 3 research articles and new prints from World New Science reports instigate me to do this awareness video program to all the peoples that why masks are mandatory in special new COVID variant Omicron and this lockdown fear. People doesn't want to get panic because of this new upcoming variant. We have to be appropriate with the wearing masks. And article number 1 is reducing the transmission of SARS-CoV-2. Masks and testings are necessary to combat asymptomatic spreads in aerosols and droplets by Kimberly A. Preether et al. On June 2020 Insights. And article 2, efficacy of masks and face coverings in controlling outward aerosol particle emissions from expiratory activities, science reports by Sima Azadi et al. 2020, University of California. Experimental investigations of indoor aerosol dispersions and accumulations in context of COVID-19, effects of masks and ventilations in physics of fluids, 2021, Yash et al. So all these 3 articles, it had taken a 15 days, and other infographics from WHO and other expert committees I just gone through for the past 15 days. and that type of an information instigated me to do this video. So, airborne transmission of aerosols by asymptomatic individuals while breathing, speaking, it can accumulate remains infections in indoor air for hours. So, without masks, easily we can inhale deep into the lungs. Universal masking is a mandatory, and isolating the infective asymptomatic individual is very, very important. Infected droplet size, inertia, the gravity and evaporation and distance of the droplet traveling aerosols in air. Large one will settle down faster and leads to contact the transmission. Smaller droplet particles, aerosols, will evaporate faster than settling down in the gravity. So between the people or contaminated surfaces, airborne inhalation without masks acquires 100% infections. So mask reduces airborne transmissions. In this picture, especially infections aerosol particles can be released during breathing, speaking by asymptomatic individuals. No masks, you can see this picture, no masks, the infected persons to the healthy individual, maximum exposure. Universal masking, least exposure, and particle size is mu m, 100, 10, 1 and 0.01, and in infected asymptomatic persons without masks, maximum exposure 100 mu m. Both infected and healthy wear masks, minimum exposure 10 mu m or 1 mu m. 100 mu m high viral load than average. So 1 lakh variants emitted droplets per minute during the speaking without mask, or one person is wearing a mask and another is not wearing, the chances of viral load will be more. And this is the specific reason WHO, Ministry of Health of India, our Tamil Nadu government insist COVID appropriate behavior, universal masking, surgical N95, social distancing, 6 meters distance, outdoor environment, infective aerosol particle travel the distance and more prevalent. So in indoor also high secondary transmission rates for healthcare providers especially. So this picture clearly displays without masks 90% of both persons chance of getting risk of transmission. You can see this picture very clearly. If one person is infected and not using a mask, that is, the infected person is not using a mask, and another is a healthy person using a mask, 30% of risk of transmission. So responsibility to ask that particular person to wear the mask is very important. If infected person is in mask and healthy individuals without masks, for example, then 5% of risk of transmissions. So there also the risk of transmissions will be there. So emphasize universal masking. If both of the persons infected versus healthy individuals using masks, there also 1.5% risk, indoor poor ventilated area, not in appropriate distancing, and for more hours. So more hours we are there in the indoor setting, we can get a chance of getting infections of OMICRON and other Delta variants also. So OMICRON variant detect around the world globally. So sharp increase in case numbers with almost 10 million cases in 7 days. So be safe, follow the COVID appropriate behavior. This picture shows again. So people get vaccinated. Don't think after vaccination we doesn't want to use masks. It can give immunity, of course, and save your life, but not infections. So that is very, very important. And distance to be maintained between the two peoples is at least 6 meters, and avoiding the crowds at the moment is very, very essential. So mask mandatory, and during the coughing and sneezing or speaking somewhere else, putting a mask, or just by bending the elbow, protect yourself in order to avoid the spread of aerosol particles to the other persons. So open windows in the indoors, ventilated spaces, and while touch or enter the home, Please maintain the hand hygiene. The hand washing is very, very essential. At least for 2 minutes, we have to wash our hands. Masking or life saving. Don't forget it. So keep safe. Use surgical and N95 masks. Get vaccinated if the people are unvaccinated, and do the booster doses. Wish you all the best, and once again my happy new year wishes to all in 2022. We can win from the situation. Goodbye. And if you like this video, subscribe my channel. Thank you.